joining this afternoon. I'm looking at the roll call here, so I'll just, for the public's benefit, say who's here. Amy Leone, City Manager, Mayor Nathan Johnson, Dr. Mary Milroy, and then our ex officios, we have City Attorney Rosten Herter, Community Development Director Dave Mingo, Community Development Manager Brad Bees, and Commander Jason Foote. So those are who's all here. And the first order of business is the consideration of certain businesses in ordinance number 1033. On Monday evening, the City Commission acted on the second reading of the ordinance that we recommended to them regarding closures of some of our businesses. And I think you all were listening in, or most of you were listening in, they asked that we take consideration for dog groomers, which wasn't an initial recommendation from us. Also, tanning salons, not an original recommendation from us, and hairstylists. So we said we would do that, and I'd come back to them with a recommendation based on this discussion, or just maybe findings, which I can do over email since they don't have another meeting until the 13th. But wanted to hear if anyone had any initial thoughts or comments on that.
I guess my thoughts, I did search the literature quite a bit, and I would say there isn't a lot of evidence there. So some of our decisions may not have a lot of evidence behind them. But I think in terms of the fact that we've seen the numbers in South Dakota increasing fairly rapidly, even just from yesterday to today, and that the numbers in Yankton County on the state website have certainly increased. I guess a lot of our initial thoughts were on trying to limit non-essential services to avoid as much contact as possible. And I guess I would still feel that in terms of dog groomers, in terms of tanning salons, and in terms of like hair salons, that in everything I've been able to look at from the, I found a good website on Homeland Security, some good ones from CDC. I don't see them ever listed as an essential business. And so I think in terms of trying to limit or restrict some of the non-essential services, in my opinion, those would fall under that category. And I would stay with what our original ordinance said. So.
That's where I'm at too.
Yeah, I'll see if the ex officios have anything they'd like to add. From my standpoint, what I'm understanding now from the governor, listening to her recommendation on our peak time, that's changed a little bit in the calendar, and also listening to the daily national updates from the medical professionals. I'm not talking about political updates, but the national medical doctors that are advising the federal government. They're saying that now is the time to keep the pressure on the gas pedal, not release. So for that reason, I feel like we shouldn't make any changes. Ex officios, do you guys have any other?
And I just want to make one comment. I've gotten a lot of texts and emails on this too. And I don't think it's an issue of cleanliness. I think in many cases, it's an issue of exposure. And if, say, a person is a salon stylist, and a person, and we are seeing that there are increasing numbers of cases that are documented from asymptomatic carriers. I mean, that evidence is growing. So an asymptomatic carrier comes into your salon, your tanning bed, brings their dog in to you, and they're asymptomatic, but they expose you. So it doesn't actually, you can have the cleanest salon in the world, and if that person comes in and exposes you, we're exposing some of those people to risk, I think. And if our goal is to protect people, then I would stay with that. But in no means, then I think the cleanliness really of the salon or the tanning booth or the dog groomer is really irrelevant to the risk of exposure to the person who runs that business.
I would agree. I haven't seen anything in the research I've done in the last few days, and the research I've seen that Brad's done a good job of too, that would lead us to back off any of the initial provisions of the ordinance. You know, just for example, with the topic of pet grooming, there's comments in CDC literature that discuss treating pets similar to how you would treat humans as far as social distancing is concerned. And you don't know if that pet has come from a home that has an asymptomatic person in it. And, you know, with CDC guidelines, as far as, you know, we should be thinking of pets as people and, you know, take care of them and social distance from them also. And I don't see any reason why we'd change the position of the current language right now.
I agree with everybody else too on that. You know, pet grooming, they got to remember that it's not just the dog they're coming in contact. There's a collar on the dog or the animal. There's a leash when they walk them in. So there's equipment transfer, and that stuff can transfer those kinds of the virus. That could be how it comes in contact with somebody.
Well, it sounds like we're all in agreement there. What I plan to do is I'll send an email and I'll copy everybody on that, likely tomorrow, to the commission and say, you know, we met, we discussed these things for these reasons. This is our recommendation. Now they can make changes. That's their purview. But unless I hear from them, I don't see that this ordinance would be on the agenda for them to make changes on. But I'll get that to them early enough so they can, you know, think about those types of things. Unless there's anything more on that, I'll go to the next topic, which was talking about the essential and non-essential services. You know, we thought that as we go ahead here, we should talk a little bit about what that means should we get to a point where we want to make more recommendations to the city commission. And in our research and talking to local manufacturers, we understand now that oftentimes they're using the guidelines that were laid forth for them following 9/11 through Homeland Security, which delineate really the categories of businesses that would be essential and non-essential based on the federal guidelines. So we may suggest that as a delineation, or add or subtract businesses that we consider to be essential or non-essential, but we would not be the notification arm of that. If we were to make a recommendation to the commission to do something else with their ordinance, it would be the onus of the actual employer to make that determination and then to give their employees documentation that in fact that they're part of that group. That seems to me to be reasonable. But of course, we want to discuss that and talk about that as well.
I think it makes a lot of sense to follow the Department of Homeland delineations for that, because that's what I'm guessing most, if not all, other states are using. And then so our companies that are either nationally or internationally based, they'll have experience with this elsewhere and know how that works. And like you said, it takes the onus off of us and puts it in their court.
Also online, they have one that Homeland Security, the CISA came out just on March 19 of 2020. So, I mean, they have actually identified critical infrastructure during COVID-19. And so they have in their department, I think, reviewed this extensively and published this on March 19. I'd say that's a great way to go with what they said rather than, you know, us trying to come up with something different or, you know, we can review that, but I think I read it and it looks really quite good.
Yeah, and there's actually a memo updating that on the 30th as well. So they got some feedback about some industries and supply chain things. And it really is a complicated topic when you start to connect supply chains and industries that interrelate and interconnect. And I know that they're hearing feedback, and I was on a call where the Homeland Security folks talked about getting feedback from industries to understand better from trade groups and industry groups, you know, how the closure of particular things can have an unintended side effect in somewhere else along the service or supply chain.
Yeah, I think they have come up and said that they will be doing regular guidance updates on that too. So I think that looks like a great resource to use.
Yes, so if we were to get to any additional steps in our ordinance, the only people we would be issuing, notification to would be our own employees. It's pretty obvious if you're in a police car that you're a police officer or should be. But if you're, driving to work and you're a solid waste employee, that may not be recognizable by other folks. But again, I don't think we're at that step yet, but good just to start talking about the structure of that should we need to move in any, forward in any additional way. One thing I would ask that maybe this group start thinking about, and we start having conversations, and I'd say plural conversations, because I think it's more than one conversation. Now that we're starting to hear a little more of a timeline firm up, and I think tomorrow there's some data coming out from the governor's office that we're going to have access to that might even give us a better indication of timeline. What does that time frame look like, and what types of things would trigger additional action recommendation from us? I haven't given that as much thought as I want, so I still want to think about that, but my initial thought is that's a time when we might bring additional and I know you're a medical professional, Dr. Milroy, but somebody that's perhaps in the inner workings of space, hospital space and hospital, maybe a Doug Ekron or an Ashley at the hospital, or somebody that actually would know the levels and how we're keeping up in the medical world.
Yeah, I think that'd be really helpful to know really what our capabilities are and what kind of stress they're under, what kind of reserve they have. It'd be great.
Yeah, I think so. Just so the rest of the board knows, and I hope you don't mind me sharing this now, Amy. Amy and I were on a call with the governor today, Governor Noem, with other first-class city mayors around the state, and she talked about how Monument, Avera, and Sanford will be in a meeting with her tomorrow to agree on their projections, because everyone now has slightly different views of how this is going to play out, but they hope to all get on the same page, or at least close enough that they can have a unified front on that. And she has vowed that she will make that information available to the counties, because they will have data broken down on the county level. So that will give us more of a playbook for what to expect in the months ahead. She did say that the mitigation efforts that have occurred so far have helped. Therefore, her announcement yesterday that she doesn't think the peak will happen until late summer versus May. So that means we really could be in this for the long run. And how our response looks like during those months, that's something we'll be wrestling with. Can we keep things this lockdown or even more lockdown for that long, or are we able to work within that to relieve things if we see infection? So like if we get to a point where a certain number of people have been infected already, can we let them go out into the community and do things? And I mean, there's a lot to consider, as we all know. And the reality of this has changed by the week, by the day sometimes. So what we're saying now may be different from 2 weeks from now, but hopefully that data will give us a lot more to work with as we think about the long-term implications of this. To Amy's point about having someone maybe from the hospital with us to weigh in on whether we were to take another mitigation step of shutting everything down except what's deemed essential services or businesses. I think Avera would definitely be interested in that. Maybe someone from the medical clinic would be interested in that, being a part of that discussion, just so we give the public faith that we are really working off the science of this, and that we have the buy-in of our medical experts in the community. That being said, we of course trust all of your recommendations, Dr. Milroy.
My sense is
Your input's good.
I'm sorry, go ahead, doctor.
I just said, I think hearing from, more of a unified voice is always helpful. That's a good thing.
Yeah, and I think, for example, I know, Nathan, in your professional role, you might know how many beds are full every day, but maybe it isn't a bed issue. Maybe it becomes a staff issue, or so having them working with us to help make those decisions, and like you said, communicating to the public, I think is going to be really a helpful thing as we move ahead.
Yeah, I mean, it's an equipment issue as well, ventilators, things like that. And, that's a situation that could definitely change a lot within the matter of a week, depending how much production gets underway in this country and the supply chains. So, yeah, it'd be good to have their input on where we're going forward.
I think, that terminology that you just used, Mayor, is critical to this discussion. It has to do with overall capacity, and having Dr. Milroy on the health board is as we've mentioned, an awesome resource, but having somebody from the inner workings of the facilities themselves, where they have access to information about capacity in general, and capacity means equipment, space, staff, everything, all encompassing, I think is going to be important. And the nice thing about that, if there is, something that can be helpful, is they'll have a pretty good projection with days in advance notice. So I don't think that that's going to be something that jumps up and surprises us in a few hours. I think, there's a 3 to 5 to 7 day, window that they're going to have a pretty good idea of what's going on and what's coming. And that gives us some time to react to and to have, consider triggers.
And I'll reach out to Doug Ekran and Chuck Ahman and, ask them, kind of frame this for them and ask them, when we get to this point, it might not be them personally, but can we get, participation from you on these things? And when that data from the governor is available, if I have a deck or a PowerPoint, I don't know what we'll have, but I'll make sure I get that out. And to me, that could be something that we can share with the public. I don't think those things are secretive. Why wouldn't they want to know as well? I think that would be valuable. Also, as an education tool, one thing that I think, just sort of as a state and as a country, we always can do a better job of, no matter how well we're doing, is educating people, because we can help them, help the whole community by making choices. So, maybe it's essential that you get a few things at Hy-Vee, but maybe you go once per week instead of, every day, or maybe, you really have to pick up your prescription. But if you pick up your prescription and you need milk, maybe you just go to Walgreens and you don't go to Walgreens and Hy-Vee, or you combine some things like that. So just helping people think about those, because this is a way of life we've never thought about before. And, I think that those are things we can also recommend, or tell the commission, hey, we recommend that, you give some guidance to staff to push some more education or something like that.
Yeah, I would hope that we don't get the projections with the instructions that you're supposed to keep these secret or not talk about some of them, because I think transparency is key in helping the public understand the situation, and also have faith that we know what we're talking about. We're not just making stuff up so we can make arbitrary rules. The more you can educate and have people involved in that decision-making process, the better. Unfortunately, we've had to make some quick decisions here in the last few weeks that haven't had as much discussion as we would normally like. But going forward, maybe, possibly, we'll have more time to work through these things.
Yeah, I would think the more education and information is there, the better there's going to be community buy-in. And that is going to be essential, because we do ask the citizens to take a certain responsibility. I mean, we can't go with them and make sure that they make one stop versus two, or go out weekly. I mean, that's a individual choice. And I think the more information that people have, the more buy-in they have, and the more likely they are to want to do those things. And so I'm hoping that they put all that information up on their website. I hope they do a news conference. I truly do hope they get it out very widely.
I've talked to my colleagues around the country, and they've all said that communication has been the key to get the citizens to cooperate and go along with what officials are telling them to do. And they don't have to have very much contact with law enforcement, because they get that buy-in from them as they communicate openly. So that's a good thing to do, and what we should really be pushing out is all that communication like we have.
Yeah, I think so. There are a couple other topics not on the agenda that I thought that we've talked about a little bit before, but for the sake of the discussion and the sake of the input and feedback we're getting at the city, I wanted to bounce off of the health board. If we're ready to move on, are we ready to move forward? Okay. So the issue of playgrounds and play equipment has come up to me multiple times, and I think we are on the right track. One question I had is what other cities are doing. So there's some cities who have, I guess, blocked off or roped off play equipment. There's some who have just said their play equipment is closed, and they haven't created physical barriers. There's some who have done nothing, and there's some who've done things like we have and said, hey, we think that transmission on this type of equipment is probably low, or the risk is low, especially if you're practicing social distancing and hygiene, and left it at that. So I wanted to bring that forward, and keeping in mind that anything that we do is something that we're going to probably need to be consistent with throughout the course of the summer now, at least the months of May, June, and probably July. So I think that we should keep talking about it if people keep talking to us about it. However, I would look to Dr. Milroy to see if her medical advice is different than it was a week ago.
I'm glad you brought that topic up, because of all the different messages, emails, texts that I've gotten, it has pretty much been around playground equipment. And I have received quite a number of comments, and they have all been regarding seeing large groups of people either playing basketball or children climbing all over the equipment, pretty much unsupervised in large groups, and having expressing concern about the wisdom of allowing that. I guess I don't know if I have any firm data as far as how risky it is, but you know, I would say that that's something we definitely need to watch, and I would say maybe more educational efforts out to the community. And if that just is unsuccessful, then maybe we would have to look at making that recommendation too. You know, I would hope we wouldn't have to do that, but if we see that there's a lot of ignoring of safe practice, and so that there isn't social distancing, there is not sanitizing hands and things, that we may need to revisit that recommendation to the city commission. But anyway, I've just had a lot of people saying that they are observing that people are not following the recommended rules much at all.
And to me, those are kind of two different conversations a little bit, because, you know, whether or not people follow those policies and take personal responsibility for themselves or their children or their groups, I don't know that we can, as a health board, mitigate to every extent. I mean, certainly we could, you know, close playgrounds, close basketball courts, close pickleball, close tennis, close sidewalks. How far do we go? I think this is about mitigation, and our role is about making recommendations regarding mitigation. But I don't know that we're going to be able to find solutions for every individual. But like you're saying, I want to keep talking about it if it's important in our community. I'm not sure what other people.
Is the school shutting down their playgrounds?
Yes,
They
they
have
did. I
shut
saw
down
on their website they did.
They have shut down their playground, but their facility is closed. I've had multiple conversations with Todd Larson, who's our Parks and Rec director, and he and I talked about the fact that, you know, a Summit Activity Center or an enclosed space is far easier to close and keep closed than an open space. Also, we talked about the fact that the federal government has not closed, you know, open areas. They've closed some national parks based on the types of facilities within them. But to my knowledge, you know, they're not closing open space and structures. So I think we should still keep talking about it. But I also want to think about the fact, like the governor said, we've got a this is a long-term thing. And we have to, whatever we're going to be doing, we have to be prepared long-term. So
Yeah. We can't kennel our children during the day, and you know, they're so limited on many things that they're used to doing right now. So you hate to close off that outlet for them to get out and burn off some energy. And so I haven't seen any real science about it, I guess. I would think that spread of the disease on a surface like that's outdoors is going to be less likely than it would be even indoors. And I wonder, you know, is this more of an education issue? Would the school system maybe help us reach out to kids in their online studies right now, remind them of the importance of, you know, the city has the playgrounds open, but remember, you cannot gather in groups of more than 10. Please think about bringing hand sanitizer with you, just being responsible. So between parents and the schools, hopefully we can curb some of this behavior we've been seeing in the last week. Because I've been getting a lot of those messages too.
I did notice that the National Recreation and Park Association published a blog page on April 1st that was actually called How to Communicate to Your Public About Safe Use of Parks. And in there, I did not see that they recommended closing, but they did recommend some different things, including using messaging that reinforces need for the community to work together to keep parks open. You know, I think that's some of the message we need to say. We need to work together. If we, you know, we all want these to stay, but we need to work together. So it's not us just pointing a finger and saying, you need to do this. This is something we need to do together. They have some primary talking points. They suggested posting some signage with consistent messaging, which is something I think might be very helpful at our parks. They said working with local media and using every communication channel that you can. But it was it's under the National Recreation and Park Association. But really a helpful publication just came out yesterday. And I like that. I liked the idea of putting up some messaging, some signs, some messaging, and working with our local media and communicating that we're all working on this together. We're not.
Yeah.
Making a suggestion.
I'll visit with the park staff about that very thing. You know, for example, if people can use in this pandemic situation, people can use the sidewalk inappropriately. I mean, people can use, you know, so I think that is a key of the education and communication and discussing that. And I think that will be helpful. I've had already discussions about let's have, you know, make sure when we do open the restrooms with our weather now still freezing temperatures, we haven't opened restrooms yet, but my intention is to discuss this as we go forward. But I think opening the restrooms in the park is a good thing, gives people the opportunity to wash their hands, and you can wash your hands and go on a play structure and leave and wash your hands again. And in a lot of cases, not even have to touch doors to do that. So I think that's a good move and prudent move at this point. And I also think from an enforcement perspective, people have to kind of self-police a little bit on these things. You know, we don't have, our police department's amazing, but they don't have, they can't possibly have eyes everywhere. So people need to also be informed of what's healthy and what's not healthy and what's allowed and not allowed, and take some responsibility there.
Yeah, and I agree. I saw the same posting you did, Dr. Milroy, and I was looking at some of that information. There's some good graphics in there too that are kind of attractive and help explain it in a visual way that's always easier for people, I think, to understand. I wanted to give a little bit of credit to folks I've seen doing the right thing. We live close to a park, and my wife and daughter and I have been on a lot of walks lately through the park. And by and large, I'm seeing people get the message. And we had folks leave the sidewalk to avoid being close to us with our stroller. And so there's a lot of good behavior being modeled, which I think we're in the beginning stages of seeing good behavior and then recognizing, oh, I understand why that person is doing what they're doing. That's right, I was supposed to do that too. And giving people credit that this is a new way, like Amy said, this is a new way of living that it's going to take us a while to bring on board.
Yeah, I agree. And we talked a little bit about pets with the dog grooming, but I think, you know, we're hearing, you know, people need to treat pets like members of their family. And we know people do on a regular basis, but even more so now, you know, we have to be careful and remind folks about, you know, good, if you have sick people in your home, you know, the pets are around them and they can move around the house. And so you have to take some measures there as well. So I'm hoping that things at the city can slow down enough to get more education out there as well and be more of a support network for people on that. I don't have other topics other than in thinking about how we've been meeting as a group, wondering if it didn't have some merit to establish maybe 2 regular weekly meetings, knowing we can always call additional ones. But I feel that for transparency, so the public can expect when we are going to have a meeting, and also just our consistency of this is when our health board meetings are, might be useful. I'm seeing head bobs. We can always, if we get together at a regular time and we don't have much to talk about, we can always say we don't have anything, today to talk about, and just sign off. But I was hoping Mondays and Thursdays, in the sense that Thursday, then if there is a recommendation, we have time to work on it and get it put out to the commission before their Monday meeting. And then Monday, they have the meeting. So, and then we have the weekend time frame to get things pulled together if we need to for a meeting. So I was thinking like 2 o'clock on Mondays and Thursdays regularly, but I'll throw that out to the group and see what the availability is.
I think that could work for me.
Ross, by and large, does that work for you?
Yeah, that works for me.
So let's plan on Mondays and Thursdays. So our next meeting would then be Monday, April the 6th at 2 o'clock. I'll set those up as a regular meeting, send an invitation out to everyone, and then we'll I'll talk with IT and meeting organizing if we need to have a different link every time or how that would exactly work. But we'll get information out to everybody. And then if we need a special meeting, we can certainly have that. I just feel like we're going to have to, it's not going to be just an ad hoc thing. This group is going to probably be together for a while.
Before we conclude the meeting, Amy, can you give an update on how the ordinance has gone so far? Have we had problems with enforcement or anything like that?
So we've had, I think, really good compliance by and large so far. We've had a couple calls, and we have had our police department visit with some proprietors, a couple of, I would say, I wouldn't even say a handful, I'd really say a couple, about the ordinance and talking to them about, hey, this is in effect now. So I think by and large, we've had great compliance. We've had mostly questions about, okay, is it okay if I do this? Is it okay if I operate this way? So in that regard, we've had a couple people reach out to us and say, again, this employer is not following this, or this employer may not be separating people. So, but I think that's education as well. So we've been working with YAPG and the Chamber of Commerce with Nancy Winandy and Carmen Schramm on helping to get information out to our employers. Whether they are included or excluded in this ordinance, there is a lot of information on CDC that is helpful to them. So I think by and large, it's gone pretty well. I think the weather plays in our favor for the fact of social distancing now that we're going to have this weekend. I think that the key will come when we start getting the warmer weekends for bars and restaurants, talking through that with them. And then, of course, the salons is sort of a regular operating. They operate sometimes 6 or even 7 days a week. So I think that, is harder on them in that sense, but they're certainly, they've been complying. So Jason, do you have any sort of inside knowledge from the PD on that?
No, I think we had a total of 3 calls, and basically it was just a little education, a little confusion on a couple of them. They thought they were exempt, and we just explained the ordinance, and we had compliance, so it was pretty good. Everybody that I've seen is complying voluntarily, so I think things are going good.
I think, Mayor, one thing people need to understand with the bars is that if they have off sale, meaning if they have a license where you can go in and buy a 6-pack or case of beer or whatever it is that you like to drink, that's an operation that can still exist. So you might see a light in a bar, and that doesn't necessarily mean they're violating the ordinance. That, so there's those efforts. And some of our places that sell alcohol are restaurants as well. So they may be doing a takeout operation. Of course, Minerva's has the ability to do room service for their rooms. So, some of the calls that I'm getting or emails I'm getting are kind of like, well, I saw a light on here, this person's open. Well, they are following the ordinance. They have some ways that they can still conduct their business. So but lots of drive-throughs. I think drive-throughs have been busy, and those are permissible. So. Anything else from the health board for the good of the order? Okay, I would then ask for a motion to adjourn.
So moved.
I'll second.
Okay, and all in favor signify by saying aye. I'm an aye.
Aye.
Okay, that's opposed, same side. I heard all three of us vote, so. All right, we will plan for Monday, April the 6th, and at 2:00, unless something should happen before, and we'd contact you.
Thank you, everyone.
Thank
Yep,
you.
thanks, everybody.